The kidneys are located deep within the abdomen, dorsal to the intestinal mass on the right side, and dorsal to the colon and spleen on the left. The left kidney is more caudal than the right kidney and is easier to access, even though it is sometimes partially hidden by the costal arch, like in this dog. The spleen can be used as an acoustic window when imaging the left kidney. Its echogenicity is also used as a guide when evaluating the one of the kidney. The right kidney is buried to a greater degree and can sometimes be challenging to identify because of overlapping ribs and lungs and by other artifacts created by the contents of the duodenum, colon, and cecum. The cranial pole is lodged in the renal fossa of the caudate lobe of the liver, and their echogenicities can be compared. The right kidney is also located near the right lobe of the pancreas and can be used as a guide to locate this organ. Kidneys are also in proximity to the colon, which can affect their visualization. The gas and feces in the colon will have to be bypassed so the ultrasound waves can reach these kidneys. Going deeper, we can see the aorta and caudal venae cava, which extend medially and dorsally in the abdomen between the two kidneys and are connected to these organs by the renal arteries and veins, respectively. The ureters exit the renal pelvis and travel through the ureteroperitoneal space, eventually reaching the ureterovesical junctions located on the left and right dorsolateral surfaces of the bladder neck. A convex probe facilitates renal examination because its smaller surface, or footprint, is easier to manipulate through the area. With the marker faced cranially, the kidney is first identified in the longitudinal plane. The cortex is more echogenic than the medulla, which is nearly anechoic. The medulla is wavy at the junction with the cortex. The left renal artery and vein can be traced back to their respective connection to the aorta and vena cava. This procedure will help to identify the left adrenal gland. Kidney size varies considerably in dogs with different body conformation and size. The diameter of the aortic lumen in this region can be used to estimate the size of the kidneys by comparing it to the length of each kidney. Divide the measurement obtained for the length of each kidney by the diameter of the aorta measured during systole, which is the largest diameter, to obtain a ratio. This ratio should vary between 5.5 and 9.1. In cats, a normal kidney size is between 3 and 4.3 cm in length, depending on the size of the cat. After a thorough evaluation of the left kidney in the longitudinal plane, the probe is turned around to view the transverse plane, with the pointer on the right side of the dog. In this plane, the renal sinus on the medial side will be on the left side of the image, while the cortex will be turned laterally. The renal crest extends medially with the pelvis at the edge. The pelvis should measure less than 2 mm in width, but it can dilate during a phase of increased diuresis. This view also helps us locate the ureter that extends medially and caudally. Since the ureter is not normally visible, when it can be identified, we have reason to suspect inflammation or obstruction. In the same way as in the longitudinal plane, the probe will have to be slid from one end of the kidney to the other in order to view the entire organ. A high-frequency linear probe provides high-definition and high-quality images, especially if the kidneys are located very superficially in the body. Color Doppler enables to see the interlobar and arcuate vessels, and sometimes even smaller ones coursing through the cortex. In a well-vascularized kidney, color signals are expected in all sections. Color Doppler will also be useful in distinguishing certain anechoic segments, such as the pelvis and ureter, and the blood vessels. Non-uniform vascularization can indicate ischemia, tumor infiltration, or inflammation. The hyperechoic double walls of intrarenal vessels can also be detected in B mode, especially when using a high-frequency probe. The interlobar vessels penetrate the medulla, dividing it into lobulated segments, joining the arcuate vessels at the corticomedullary junction. Observe the clear distinction between the cortex and medulla and the echogenic differences between these two regions, as well as between the splenic parenchyma located ventrally. Take a look at the complete kidney scan in both of these planes. A convex probe is particularly useful when evaluating the right kidney in dogs because it's located more dorsally and cranially compared to the left kidney. Approaching the scan from between the ribs may even be necessary at times, especially in deep-chested dogs. The right kidney usually appears oblique on the image due to the angle of the probe. Because the liver is nearby, we can compare its echogenicity with that of the kidney. The renal cortex is normally hypoechoic or isoechoic compared to the liver, but sometimes it will appear hyperechoic in elderly animals and obese felines. A transverse plane is then used to complete the evaluation. The colon will show up from time to time on these images and may limit your access to the right kidney. It's important to manipulate the probe with sensitivity and apply varying amounts of pressure to get around or even push the colon out of the way so that you can scan the kidney properly.